Hello guys, welcome to this session, and today we are discussing Digitalis, right? So Digitalis, also known as Digitalis purpurea, okay, or foxglove plant. I don't know why they call it foxglove, but I can't see a fox and a globe. Nevertheless, this is Digitalis purpurea or foxglove plant, right? And basically you have a drug which is very famous, and the active principle is that drug only. And the drug which you might have knowing, AP is active principle, and the active principle is basically digoxin. You must have heard this in your cardiac pharmacology, okay. Digoxin nowadays not much used because of many side effects. Digitoxin, digitalis itself, and digitonin, and these are basically cardiac glycosides. These are basically cardiac glycosides, okay. These are cardiac glycosides, and the mechanism of action is that they inhibit the sodium potassium ATPase pump. They inhibit the sodium potassium ATPase pump. Inhibit the sodium potassium ATPase pump, okay. And by inhibiting this, they cause some cardiac effects like arrhythmia. Since the sodium potassium ATPase is blocked, the potassium levels will decrease in cell but increase in blood, and this increase in potassium level in blood is called as hyperkalemia. And this hyperkalemia can predispose a person to arrhythmia again, okay. So basically arrhythmic symptoms are that digoxin is an anti-arrhythmic drug, but not anti-arrhythmic you can say, but a cardiac inotropic drug, okay, but itself poses the risk of causing this arrhythmias, right? So this thing is you can just keep in mind, and whenever you are reading you can just integrate it with pharmacology, right? It's not much important one. And the main thing which I want to tell you is the treatment. How can you treat it, which is the primary duty of yours, right? The first thing, which is general one, decontamination, and we have a specific one, antibody which binds to the FAB portion. I must assume that you must have heard about FC portion and FAB portion, AB and FC of antibody, right? So it binds to the FAB portion of this molecule, and this FAB antibody is known as digibind. Okay, this digibind is the main treatment, but this is not commonly you can say available here, okay. It's an orphan drug, and this completes our small part, little bit you have to know about this, okay. Let me show you the plant. You can see it's a beautiful plant, but if it is eaten then it's dangerous, okay. So this you have to understand and read. That's all in today's session. Let's meet in another poison. Bye bye.